Wellbeing project's all about reaching out to the community to provide them with information about different topics of health. We've obviously got the group drop-in, which is to talk about dementia, but either side of that there is a health checks that can be done, so people can access those health checks. This obviously helps people to get appointments easier so that we're not actually clogging up the GP services just to get health checks, but also they're getting the information about different subjects. Under the umbrella of the Senhouse Centre, we've always been very keen on providing health checks to the community. And obviously we've teamed up with CHoC and her group from the NHS, which has been fantastic to have them in a community centre as well, because it's more accessible. And the times are during the day, so anybody can access them. It's open to everybody. So obviously the uptake on the health checks have been really good. And that's why we got involved, because as a healthy living centre, we want to promote good health and promote, positive healthy living, really.
So we are based at the Senhouse Centre in Whitehaven. The past 3 weeks so far that we've run, we've done a healthy eating, a common illnesses, and this week is dementia awareness. So it's basically just for people to come and get some information. If they've got any concerns about any topics that we're running, they can either come to the drop-in and also they can have a pre-bookable appointment with either a nurse practitioner or a healthcare assistant.
West Cumbria does have pockets of social deprivation and isolation, a rural community, and certainly a project focused in the centre of town is quite accessible to local residents. Patients are allowed to access the services on a very relaxed basis, coming in for a cup of tea, biscuits, and a general chat. They will be offered near-patient testing for cholesterol and diabetes, blood pressure checks with one of our healthcare assistants, and then offered the opportunity to speak to a clinician, including myself, for more to address more complex health needs or on-the-day needs.
So my specific role within this project is to provide the physical health checks for those that are partaking. That involves height, weight, blood pressures, but we're also able to do on-the-spot cholesterol and diabetic checks for people as well. So anybody that may have not been able to get into a GP practice for their annual health checks for any reason, we're reaching out and getting to people in the community, trying to provide those gaps in their healthcare. We're able then to give all of that information directly back to the GP as well. Well, the project's needed because we need to, certainly since COVID, we need to fill those gaps that have occurred. So a lot of GP practices were not available. They've now got that backlog because of the length of time that they were unavailable.
So to assess the effectiveness of the project, we'll be getting the word out there, reaching out to other various community groups and working in partnership with them to invite patients to come in and have their basic health checks. Obviously numbers are going to be a good indicator as to how successful this project is going to be. And feedback, it's always good to get some feedback. We've already had some feedback from patients that have visited us, stating about the relaxed environment and feeling very much that there is no limitation on time that they could spend with us. Okay, it would be nice to see the project grow, and I think it's got to be very much patient focused. As to, it's quite likely you would establish a regular group of people that would attend as well as incomers, and it would be good to go with what they would like, various topics that they would like addressed, as well as kind of baseline topics that we do have already in place to address things like common illnesses, identifying common illnesses, dementia awareness, healthy eating, weight management, full range of topics, but it would be nice to know what the clients would actually like us to address for them.
Well, I see the project moving forward with more community-based checks, getting into more places like today, getting into community centres, more GP surgeries, having rooms available for us to run these clinics as well. And it's growing all the time as word of mouth goes around. We're finding we're getting more and more people through the door. We're getting lots more sort of just footfall with people just turning up on the day as well, and we're able to squeeze those in.
If you speak to anybody now, it's very difficult to get a GP's appointment, even with a nurse practitioner, or get a health check. And sometimes it's not convenient for people to sit on the phone waiting hours for this. It's more convenient for them to see it on social media, and they can just book in straight away and they'll get seen for that clinic that they've booked in for, which is very positive, I feel.
I think I would just like to say that it's an excellent service, and we are encouraged now to be very health aware, self-aware, and come and get checked out. Come and tell us what you would like us to address, and if we don't know the answers, then we will find the answers and signpost you to appropriate services that can support.
Well, Copeland Community Fund obviously have provided the funds for this project, which I think is very good, really, because it's all about the community fund, isn't it? And supporting the community. And yes, if we're successful, we'll be asking for some more money. But thank you very much for what we've been given.